Some women spot when they release an egg mid-cycle, pregnancy. Light bleeding can happen early on when the embryo attaches to the uterus. PCOS, that's when your ovaries make too many male hormones and it can mess with your cycle. Infections like yeast infections or STDs can lead to spotting. Menopause hormone changes can make your cycle unpredictable. And yeah, even rough sex or any kind of trauma to the vagina can cause bleeding. Is it spotting or is it your period? What's going on? We're going to talk about that today, so stay tuned. Hey guys, welcome back to my channel where we discuss all things periods, pregnancy, and everything in between. I'm a board-certified OB-GYN and mom to 4. And if you're new here, welcome. I hope you find lots of helpful and useful information. If you have ever been pregnant or have ever had sex, then this could be an important topic for you. This video will cover what is considered spotting versus a period, the causes of bleeding after sex, when to call your doctor, and how to stop bleeding after sex. Also, if you learn anything from this video, please make sure to share it with your friends and family. Okay, so let's start with the basics. What is considered spotting versus a period? How heavy should it be? When you think of your period, you probably think of that time of the month when you have cramps and need to change your pad or your tampon every few minutes because it's really heavy. But did you know that spotting is actually considered any vaginal bleeding that occurs outside of your normal menstrual cycle? A period can be heavy, light, long, or short. There is no set amount of blood loss that is considered a period. What is considered a normal period for one person might be different for another. Spotting, on the other hand, is usually much lighter than your typical period and can be irregular. Sometimes you might even think that it's just a small accident that happened and not your actual period. Well, the best way to tell the difference is by the timing of the bleeding. If you are having regular cycles and the bleeding occurs between your cycles, then it's likely spotting. However, if you miss a period and then start having really bad cramps and bleeding, then it's likely that you've just started your period. Another thing that can help you tell the difference is the color of the bleeding. Typically, when you start your period, it's bright red, and if it's brown or pink and light, it's probably spotting. Now that we understand the difference between spotting and a period, let's talk about why you might be getting it. There are many reasons why you might get a period, but there are only a few reasons why you might get spotting. The most common cause of bleeding after sex is when you get an injury to the tissue inside the vagina. This is often called a vaginal abrasion. Vaginal abrasions are usually caused by something like a contact lens left in too long or an IUD insertion. Most of the time, they are not serious and clear up on their own. However, if you are experiencing severe pain or bleeding, make sure to call your OB-GYN and let them know what's going on. You may need to come in for a visit to ensure that there is no infection or other complication from the injury. They can also cause women to have heavier periods or irregular periods. And most of the time, these polyps are benign, meaning they are not cancerous. If you're worried that you may have a polyp, it's a good idea to schedule an appointment with your OB-GYN to get checked out. Well, fibroids are little benign tumors that grow in the muscle wall of the uterus, and they can sometimes bleed into the uterine cavity. Bleeding after sex isn't always the result of a problem. It can also happen because of certain birth control methods. For example, hormonal IUDs have a small percentage of women who have some bleeding after sex, especially during the first 3 months after insertion. If you do have a hormonal IUD and you're having bleeding after sex, it's a good idea to check the strings of the IUD to make sure that it hasn't been expelled. Other times, bleeding after sex can be a sign of something more serious, such as an ectopic pregnancy, a miscarriage, a cervical or endometrial cancer, or something else. Ectopic pregnancy happens when a fertilized egg implants outside of the uterus. This is a life-threatening emergency and requires immediate medical attention. A miscarriage is when a pregnancy ends before 20 weeks gestation. If you're experiencing bleeding and cramping, it's important to see your provider right away. Your provider can perform an ultrasound to determine if there is still a heartbeat and if the pregnancy is viable. Endometrial cancer is a type of cancer that affects the lining of the uterus, and cervical cancer is a type of cancer that affects the cervix. Both of these types of cancer can cause bleeding after sex. The last category is something called other. This can be something simple, like a foreign body in the vagina, or something more serious like a fistula. A foreign body in the vagina is exactly what it sounds like, something like a tampon that was left in too long, or something a little more random, like a piece of wire. This can easily be treated by seeing your OB-GYN and having them remove the object. A fistula is a hole that forms between two organs that don't normally connect. This can happen after childbirth or as a result of another condition like Crohn's disease. If you think you may have a fistula, it's important to talk to your provider about your symptoms and get evaluated. You should call your doctor if you are experiencing bleeding after sex, even if it's just a small amount. It's also important to call your doctor if the bleeding does not stop after a few hours. If you're pregnant and experiencing any kind of bleeding, call your doctor immediately. If you're not pregnant but having bleeding that looks like a period, you may just have started your period early. You should also call your doctor if you're experiencing any kind of pain with the bleeding. Painful bleeding after sex is never normal and may be a sign of something more serious going on. Now I want to touch briefly on how to stop bleeding after sex. If you are experiencing bleeding after sex, you can try a few things to help stop it. First, you can try lying down on your back with your feet up. This will help gravity pull the blood back into your vagina. You can also try putting a cold compress on your abdomen. This can help constrict the blood vessels and reduce the bleeding. Finally, if you're still having bleeding, you can use a pad or tampon to absorb the blood. Well, that's it for this video. I hope you learned something new and feel more confident about your health. Please remember to share this video with your friends and family and hit that thumbs up button if you liked it. Thank you so much for watching.